Welcome to Healthcare Simplified, a podcast from DeliverHealth. Nothing's inherently simple about healthcare. That's why on Healthcare Simplified, we explore with today's top health leaders how to maximize ROI, staff satisfaction, and public health outcomes by building greater efficiencies into the healthcare connections that matter most between clinicians and technology, providers and patients, and people and their health. I'm your host, Mitch Holdwick. Let's put simplicity to work together. Welcome and thanks for tuning in to episode 1 of Healthcare Simplified. I'm personally really excited about today's topic and episode. In addition to just loving the topic, addressing language barriers in healthcare, I'm a huge fan of our guests who we're going to introduce to you in a moment. But before we hop in, for our listeners that heard our CEO, Michael Clark, in episode 0, you'll recall he mentioned the need for health equity in healthcare, now more than ever. So we couldn't think of a more fitting, relevant, and important topic to kick it off with. So let's meet our guests. I'm going to start with Dr. Azizi Seixas. He was the director of the Media Innovation Lab at the University of Miami Miller School of Medicine, referred to as the Mill. It's an ambitious endeavor to innovate, accelerate, and disseminate accessible and effective health and wellness technologies. Dr. Seixas is an associate professor of psychiatry and behavioral sciences at the Miller School. The Mill extends the University of Miami's long-standing global initiatives to increase access to healthcare, recruit leading innovators, and reimagine learning. We personally had a chance to meet at the Business of Healthcare, Technology Access, and the New Normal this past spring at the University of Miami at the Miami Herbert Business School. So I personally know Azizi, and I'm thrilled to have him with us today. So Azizi, welcome to the show.
Wow, Mitch, thank you so much. You are soup for the soul with that introduction. So thank you so much for having me.
And we also have with us today Jason Martin. Jason is a Chief Product Officer on the Provider Services side at DeliverHealth. Jason brings more than 15 years of experience building technology and tech-enabled services to the forefront to drive change. His passion lies in his ability to develop solutions that improve operational efficiencies while empowering clinicians to spend more time with patients and less time on administrative burdens. Jason actually led on the launch of DeliverHealth's mobile language access capability to help clinicians, designed to improve existing connections between physicians and limited English proficient or LEP patients. And I got to tell you, you'll know right away when you hear him talk, it's hard not to be inspired by his passion around technology, unwavering compassion for health equity. So you'll learn really quickly why Azizi and Jason were simply a dynamic duo meant to be. Jason, welcome to the show.
Yeah, absolutely. Thank you so much, Mitch. When Azizi and I first met a few months ago, it was like kindred spirits connecting. And, Mike, a long time ago, I had this really bright person tell me that everyone has a superpower. And as I looked for my superpower, I found that I just find myself with really brilliant people like Azizi to be able to do great things. And so it's more about the coordination of effort and actually listening to those that are in the field and facing real world problems and us coming back together and putting together solutions that make sense go forward. So greatly appreciate the opportunity and certainly Azizi's willingness to participate on today's podcast.
That's great. So before we dive into today's topic, Azizi, I thought we could start with you. I'd love for our listeners to learn a little bit more about the Mill and some of the incredible work you're leading at UHealth.
Oh, thank you so much again. And, really, honored to share this screen and this, space with both of you. I think in many ways, since this is, a podcast, we're going to keep it a little light. I think, we all developed a sense of bromance when we met each other because it is so rare to find kindred spirits in this type of work, because oftentimes, folks are generally aligned when it comes to business operations and, key performing indicators, and less so around value. And I think this is where I feel both our groups here at the Media and Innovation Lab and DeliverHealth have really been in sync. That not only are we in line or aligned around, business ops as well as around key performance indicators as to how we can change healthcare for the better. But in terms of values, it's not about what you do, but how you do it and who you involve from the ecosystem to do this. So in many ways, that alignment really speaks about the DNA of who we are at the Media and Innovation Lab. We are a unique research group. It's hard to kind of nail down who we are in many ways because we want to be disruptive. We're not just a research center or a research lab. We're not just a think tank. We're not just a venture studio. We are all of those things. And essentially, we are really aiming at, tackling, I think, one of the more fundamental issues that we face in healthcare, which is how is it that we can make healthcare work for everyone, regardless of, age and, gender and race and socioeconomic background? How can we make it work for everyone? And so we believe that in order for that to occur, we need to make some significant changes with how things are done currently. And so, media is our first name. And the reason why we put media is because in order for us to make those significant changes in health outcomes and to improve health, we need to have a multi-pronged approach, or what we call different media, by which we actually enact these changes. So here's what we're doing. We're reimagining healthcare across 5 core verticals. First, through education. So what we're doing is that we know that in order for us to spawn this type of paradigmatic shifts and changes in terms of outlooks, how healthcare and medicine is practiced, not just in the ecosystem from the provider sense, but also from the side of patients, right, our consumers. And we need to really create a culture of innovation. And so we are really creating here at the University of Miami new ways in which we can train the next generation of physicians and providers and scientists, where innovation is a core pillar of what we do. And it's a core pillar of the training of physicians and providers. We're also reimagining research using our flagship framework called Precision and Personalized Population Health, which is pretty much trying to translate more easily discoveries all the way to treatments and solutions using AI, machine learning, and finding ways in which we can enrich and enhance data in a way that is simple for patients, simple for researchers, so that we can find the next causes of disease and we can find the treatments that work for whom. And so that leads us to our third vertical, which focuses on clinical care. We're trying to create a clinical care process that has an efficient process, but also one that is personalized and precise, whereby we provide the right treatment to the right person at the right time with the right dosage. And then fourth, we're trying to reimagine venture, specifically around the area of how is it that academic healthcare centers and just health systems in general can reposition themselves as not just being the purveyors of care, but also the ones who are innovating, the ones who are on the front foot, finding new solutions and ways in which we can make healthcare work for all. And last but not least, we're trying to reimagine how is it that we can restore our covenant between ourselves as clinicians and researchers and with the public. That I think one of our most sacrosanct responsibilities is that the nation looks at us, patients look to us as trusted messengers of healthcare information and recommendations, and we need to restore that. But we also need to ensure that we make these types of recommendations and treatment solutions more accessible to all, regardless of your sociodemographic background, and more germane to today's conversation, what your language capability or your communication capability is. So that's kind of how we're trying to reimagine healthcare across these 5 core verticals.
That's great, Azizi. And I love that kind of framework of the pillars. And I think about access and clinical care, and specifically the language access. That's a great segue. And I'm going to go to you, Jason. In terms of addressing language barriers in healthcare, what kind of research are you seeing on how language barriers have been shown to lead to detrimental health outcomes?
Yes, certainly. It's a great question. And it's one of which there's been studies over the last decade or so. And unfortunately, the statistics remain roughly the same or digressing in terms of outcomes. Typical experience inside the ED, their time in the EDs for an LEP patient's about 20% longer than an average patient. Once admitted or if admitted, they typically spend on average of 4 days longer inside the hospital, with about a third more of tests unnecessarily at times being performed just due to the language barrier. And then in terms of readmissions of those patients, just due to just lack of understanding of discharge information or just communication errors, around 30% more likely to get readmitted if admitted into the hospital. And certainly all of these things were amplified during COVID. There's many stories out there today about just simply, to Azizi's point, that the public looks to the healthcare system as their guide on what is going on from just knowledge base. But if you lack the language and being able to understand what's being published, which happened during COVID, you ended up with unnecessary illness in these populations that are already challenged anyways. UMass at one point in time in the peak of 2020, they reported that 60% of the patients that they were admitting inside the inpatient for inpatient stays were LEP patients, as compared to a normal percentage basis would normally be around 9%. And much of that's contributed to just simply that community was not getting the information necessarily to actually avoid inpatient stays or avoid COVID, and doing the things like, basically social distancing. All of those things just got left off for many of these communities. So I think this really amplified the need for more tech and solutions for the LEP patient population.
That's an alarming statistic. It's a good segue, Azizi. I think what I'm curious from your perspective, even more broadly, how can technology and innovation, you talked about a little bit as far as the purpose of the mill, but specifically technology and innovation, how can that reduce and in some cases eliminate disparities in healthcare access?
Yeah, sure. That's an excellent point. And, thanks to Jason for those data, because I think it provides perspective, right? And I think oftentimes these perspectives can be further contextualized in many ways in terms of, really providing solutions that fit the patient population within your catchment area. I think in many ways for us, we look at, technology in two ways, right? Technology is a tool and it can be used for good and it can be used for bad. And sorry for the oversimplification, but it's absolutely critical that we are aware of that. Why? Because it's very likely that if you go fully tech, then what ends up happening is that you might be pricing out a healthcare system or individuals who can't afford some of these technologies, which is why it's important that when we're building these solutions that we take a human-centered focus. And I know everyone throws that around, but I'll just kind of operationalize that in terms of what that means. It means, therefore, that the process in which people can kind of use or to take up these solutions, that it's not taxing, it's not cognitively demanding on individuals. And I think in many ways, this is where I think the types of technology, it's not just technology, can it be used for good or not? It's the type of technology that can be used for good. And so I just want to highlight that. But I think in many ways, how we are, and I think it's kind of the motif of the Media and Innovation Lab, is that technology for us, as a simple definition, it's making complex things simple. That's what technology is to us, and that's how we have treated technology. So for example, if there's a system that already works, why include some digital technology or some automated process if it already works? No, this is where you have to look at it from different perspectives, because it may work for some in the ecosystem and not work for others in the ecosystem, which is why it's always good to take this human-centered ecosystem approach. When we develop new technologies, we oftentimes look at the patient, we look at providers, and then anyone else who is connected to that particular solution within that ecosystem. But, specifically, I think there are some other areas in which we believe technology can work. So, for example, it can improve efficiencies in terms of moving people through a very complex, demanding healthcare journey. And we see what oftentimes happen as a kind of a wedge is someone's inability to be able to communicate on what their needs are from a patient side. And in many ways, we on the other side of providers, we are unable to provide what the values are for a particular treatment or for this, for a healthcare process. And I think this is where technology can help to better communicate on both sides and to find a common language, so to speak. And so increasing efficiency is always great. Technology can do that. It can solve many of the pain points for patients and for providers and for payers as well. And I think in many ways, it allows us to really capture what I call opportunity points. So I just highlighted two, critical pain points that we obviously need to solve in terms of access and the like, and communication and the inefficiencies and the fragmentation in the system. But, another area that I think we should build around, and technology can help us to do this, is by opportunities. So will this new technology help to scale? Will it add a new service? Would it, for example, some of the things that we're working on in terms of remote patient monitoring, will this allow healthcare teams to solve critical data gaps in their understanding of the management of their patients? And I think that's where, for us, technology is very helpful. Solving a lot of the pain points, but at the same time, allowing, systems to address opportunity points, areas of growth that can optimize what they're currently doing and to find new areas where they can provide services.
Yeah, I love your point. Just to kind of amplify what you said, Azizi, around it's not always new technology, the need to implement technology. Sometimes you have to look at the existing process and find innovation within the process. So I think that's a great point and a good segue. Jason, for you, I'd love for you to kind of talk a little bit about the joint research that's going on between DeliverHealth and the mill as it relates to language access and some of the health equity points we touched on. I can imagine so much of this hinges on the ability to have a good use case. But even prior to that, there's so much work to do from a discovery and assessment perspective, right?
Absolutely. And so it's really interesting because, I'll use a terminology that's, obviously appropriate for this space, is that when you actually have prescription before diagnosis, it leads to malpractice, right? And so part of actually what we're doing today is to really understand the core of the problem. At the provider space, we know providers are really forced today to speed through patient visits and ultimately don't have enough time really to spend with patients. And so when an LEP patient comes in the door, that time's amplified now, times 2 or 3 in terms of how long it takes them to get an interpreter on the line and ultimately see that patient. So we have to take through the lens of a provider when we're implementing technology. Does it make the provider's life easier so they can spend more time really diagnosing and spending time with the patient, more about just they came in to have a knee sprain, but they've got cardiovascular issues that actually potentially are much more important than addressing the knee sprain. So I need to get them back in to see a cardiologist. Those are kind of examples of, as we look at the problem and diving in, trying to better understand, and why the mill is so important in this process is that they help us connect with the provider. They also help us connect with the patient. That's actually the example I just provided is a real world scenario. An LEP patient may only come in to see a doctor when something critical is wrong, but they may have underlying conditions that will lead them to the ED in a much more critical state 6 months from now, because they simply are avoiding care for their diabetic conditions because they lack education, or they just simply lack access to information about what are things going on in what should be a care journey that for them, it's not a care journey. It ends up being an episode that doesn't lead to anything more than you've got a knee sprain. And so what we're excited about the partnership is that how do we actually impact the overall wellness of this LEP patient population, which we know without a doubt lacks the necessary education around just going through the care journey that they may need for chronic conditions. They lack the necessary information in many instances. So we want to make sure that they feel comfortable the moment they walk in the door, they know how to get access to care, and they actually know how to treat their chronic conditions. So certainly excited about that. And as I mentioned, that really ties back to the mill and the research that they can do for us, because we could build really great technology that never would be deployed because we didn't think through the lenses of first the patient, then the provider.
That's great. And maybe just to kind of level set for our listeners, Jason, at a high level, how does this technology work?
At a very high level, a couple of things I'll just say, value propositions in terms of what we're looking to bring. First of which is that what has been around today to support the LEP patient population has been interpreters or bilingual providers. Ideally, bilingual providers where University of Miami has leaned in hard in a Spanish-speaking community, and they're very privileged to have, I think, a large number of truly bilingual providers. But as you think about other languages, Arabic, that may be dominant in areas or really the even smaller communities, but have large LEP patient populations that they don't have the privileges of having the bilingual providers that they need to be able to interact with the patients. We connect the dots between not just the service, which has been around for years, but how you actually map that back to data that can help improve the outcomes. We connect to the electronic health record. We allow the provider to call an interpreter directly from a mobile app that connects to the schedule, which then connects to the EHR, so we can start to do analytics on having that patient's encounter mapped back to the interpretation session. We allow also language access coordinator to multi-source their language access providers. So in the event that they do have, say, in-house interpreters as well as outsourced, they want to be able to have one process for their providers, once again, making life easier on the provider, and speed to those interpretation services for the patient. And then lastly is that once they have been discharged or once they have went through that patient encounter, we can then clearly note that that patient now speaks Arabic and they needed these services. And the long-term goal is that how do we actually transition this technology to provide more empowerment directly to the patient?
I just wanted to chime in on what Jason said, because I think, Jason is absolutely correct. And I think this is why, the partnership between us and DeliverHealth is just amazing. And I think, just to pay special attention to what Jason mentioned, that here at the University of Miami, because it's such a cosmopolitan, diverse city, that in many ways, we already have some built-in resources as it relates to language access. However, there are still some challenges. And I think this is where, our partnership will allow us to identify where there are other friction points in this particular service. So I'll share with you. So when it comes to language access, picture a 75-year-old immigrant woman who is struggling to manage her diabetes. And she goes to see her primary care physician and, they recommend all these different specialists. It's not just whether or not if this particular person knows English or not, right? Or it's not just about communicating between two individuals. I think that's at the first layer. I think fundamentally what we're seeing is that it's really hard to navigate the healthcare system. Just setting aside language barrier. This is where we want to be able to partner with DeliverHealth, where we can start thinking about, does this person, meaning the person who provides, language and communication assistance, can they serve as a navigator? Can they help the person to ask the right types of questions that can lead to better understanding of the treatment plan? That's where once we peel that first layer of, do I understand this person who is sitting across from me or not? And allows us to really get at the core fundamental issues that are really solving some big pain points. So, physicians, providers will say, I thought I communicated the treatment plan effectively, and I'm not sure what happened. I brought in someone who was a translator, but perhaps that person wasn't effectively communicating what the person needs to do. Did the person assess what the patient's self-efficacy, which is a big phrase, but essentially means, can the person cognitively understand the recommendation and put it into action? Can they translate that? That's a heavy load for anyone, not just the person that I mentioned, the 75-year-old person. I think this is where language access comes in critically for us to provide that additional low-level assistance to help that person better understand, better communicate their wants, their desires, and their concerns, and then to kind of have this closed loop communication where the provider or the treatment team can share with that patient and say, hey, Miss Rodriguez, that's not what the doctor is saying. Do you know that, yes, you can eat your rice and beans, but you can't eat that. And I'm not trying to be, stereotypical here. But I think it's some of these things where providers, tell our patients, you got to follow this Mediterranean style diet, and that doesn't work. Here's someone who has been eating like this for the last 75 years. Why are you shaking their entire world saying that they have to lose their cultural identity? And I think this is where having better communication. And the last point I'll raise that I think Jason, alluded to, but I'll tackle it squarely. That there's tremendous research opportunity here. Why? Because we're starting to learn that language and speech serves as digital biomarkers to better understand risk for cognitive decline, as well as other areas as well. And I think this is where through this wonderful low touch type of solution, not only are we able to better and more effectively communicate and close that barrier between patients and treatment teams, and thus cause better understanding and thus better adherence to treatments and recommendations, but it also gives an opportunity for us to better understand and use language and speech as other types of digital biomarkers to predict, prognosis, to predict mood, to predict cognition. I think those are some of the things that we're excited about partnering with DeliverHealth.
That's great, Azizi. And I had a question all teed up about what does the future of language access look like? And I feel like you just nailed it, both you and Jason together, kind of painting both the realistic picture of what we're facing current state, but what the future may hold. So thank you so much for that thoughtful response. And we're getting close to time, so I thought I would wrap it up. We always like to ask our guests at the end of each episode, in the spirit of the podcast, Healthcare Simplified. What does Healthcare Simplified look like to you? And Jason, I'll start with you.
First is connecting the disconnected. Communication is at the core of this. So that's, why I think this initiative is so important. And so when we talk about simplifying long-term, it's about simplifying both for the provider and the patient, and quite frankly, the healthcare system. It's too complex today. We've got too much complex, disparate technology. Today, it's complicated for patients to schedule visits at some point in time. It's complicated for them to see the providers that they might need to see. And it's complicated for the providers actually to see the patients. In many instances, they're doing more administration work than they actually are treating patients. And so as we think about what is truly simplifying on the DeliverHealth side, is it's making life easier for the provider so they can spend more time with the patients, and it's giving better access to care for patients.
Yeah, and this is great. Jason stole all of mine. I'm just joking. No, I'm just joking. So I would add to all the fantastic things Jason just mentioned. I think for us, and I think it's part of the mantra at the Media and Innovation Lab, the mill, I think part of simplification means we need it to be intuitive. Intuitive in the sense that, when patients are going through the experience, we don't want patients to say, oh, why isn't it done this way? Why couldn't it be simply done this way? And I think we need to be on the front foot, being anticipatory and intuitive about, simplification of the patient experience. And not just the patient experience, but the entire ecosystem. Because oftentimes we hear, why is it that you do it that way? Because that's how we were taught how to do it. That's just kind of how, and that's groupthink. And I think as we are innovating for simplicity, which, as I shared with you earlier, that's what technology is. That's the definition of technology. We need to be so obsessed with the consumer, the patient, that whatever solutions that we create, implement, and deploy must be intuitive. We want patients to say, why is it that I have to wait to be connected to several different providers? Why don't I just have someone, by the time I leave my primary care physician, say, hey, Ms. Rodriguez, these are your appointments. This is exactly what we want. And by the way, you have a concierge system that will help you walk through the process. Oh, and by the way, you don't have to call and wait for 5, 10, 15 minutes to do this. We can do this through some kind of voice assistance program. And, Merry Christmas. Here is your Alexa. Here's your Google Mini. I think that's what we mean by intuitive. That's how you layer on technology. It's not just, wow, if you put all these technologies together, wouldn't it be cool? No, it's about, as you walk through that patient journey with Miss Rodriguez, is it intuitive? Is it anticipatory for her needs, her wants, her desires? And that's what I would highly recommend that. That's how we can innovate towards simplicity.
I love it. Well, let's end on that note. I can't think of a better way to wrap today's first episode. Again, a very special thanks to our guests, especially Azizi, for his compassion, continued partnership on such an important topic within health equity. And thanks for our listeners for tuning in. We'll catch you next time on Healthcare Simplified. Thanks again for tuning in. If you like what you heard, please share, rate, and review on Apple, Spotify, or your favorite podcasting platform. For more content about simplifying healthcare, visit DeliverHealth.com/resources, where you'll find our blog, videos, and much more. We'll see you next time on Healthcare Simplified.